Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn, and return. I have learned a lot, earned a lot, and now to return a lot to the word. The topic of today is measles. Measles, the other name is rubeola. Measles derives from an Anglo-Saxon word, measles. Its Latin name is morbili, is a tiny morbus. A disease thus signifies a minor illness. Other names of the measles are morbili, rubeola, red measles, English measles. It is one of the five classic childhood exanthems, the rashes which appear outside the body, like rubella, roseola, fifth disease, and chickenpox. Historically, measles is most common viral infections with potential complications. Both rubella, also known as German measles, and roseola are different diseases caused by the different unrelated viruses. Now, the measles have maculopapular rash, as one can see. These are on the whole body. These starts behind the ear, then front line, the hairline of the forehead, and then whole of the body is involved slowly. Now, measles is a highly contagious infectious disease caused by the measles virus. Measles virus is a member of the genus Morbili virus. The natural disease is limited to the humans and to some extent to the monkeys, and the mountain gorillas are susceptible to this disease. Also, it has been found infection confers lifelong immunity. Once one person have got the infection, there is lifelong immunity against this disease. Often regarded as a childhood illness, it can affect people of any age. Mostly the disease occur once, as I have told you, that gives the lifelong immunity. Now, history of the disease is measles began causing infections in the humans in the 4th century BC. First systematic description of the measles and its distinction from the smallpox and the chickenpox is credited to a Persian physician, Muhammad ibn Zikriya al-Razi, 862-932. He published the Book of Smallpox and the Measles an endemic disease in 1529. A measles outbreak in Cuba killed about 70% of the total population. 2 years later, measles caused 50% deaths in Honduras, Mexico, and Central America. Between 1855 and 2005, measles have killed 200 million people worldwide. Measles killed 20% of the Hawaii's population in 1850. In 1875, measles killed over 40,000 Fijians, that is 33% of the total population of the country. WHO recognized 8 clades named A, B, C, D, E, F, G, and H. And there are 23 strains of the measles virus. Morris Heilmann developed the first successful vaccine, became available in 1963, and improved measles vaccine became available in 1968. So here one can see the picture of the great man Muhammad ibn Zakaria al-Razi, and here it is the book of that is treatise on the smallpox and measles he wrote at that time, and here is the man who is the hero of making the vaccine, Morris Heilmann. Now, what is the cause of the measles? Measles caused by a measles virus is single-stranded negative sense enveloped RNA virus of genus morbillivirus within the family of Paramyxoviridae. And here one can see from the center, that is the genome or the RNA. Then there are matrix proteins, there is lipid membrane, and here there is large protein and independent RNA polymerase, and that is phosphoproteins. And here there is fusion protein that have got the name of N. Then there is a hemagglutinin H protein. These help in the attachment to the host cell, and these just for the fusion of the this virus with the host cell to get entry into that. And here is the other view of the measles virus. One can see the large protein, phosphoprotein, then RNA, and that is a nucleocapsid, and the other proteins which can be seen here. These are hemagglutinin, fusion F protein, lipid layer, and the matrix. So that is a complete structure of the measles virus with its different proteins with which it have caused the infectivity. Now, spread of the measles. Measles is an airborne disease, spreads readily from one person to next through cough and sneeze of the infected people, also spread through direct contact with mouth or the nasal secretions. It is extremely contagious. It means 9 out of the 10 people who are not immune at the same living space with an infected person will be infected. Measles virus enters host through respiratory tract, oropharynx, and possibly conjunctiva. Transmission is person to person by respiratory droplets and also by the conjunctivitis. So here one can see highly contagious. 1% who is infected is capable of giving infection to these 9%, those who are not immune. So 9 out of the 10 people can be having this problem through the cough or the sneeze of this infected person. Now the spread source of the infection is virus containing respiratory tract secretions, either airborne or transmitted by the fomites. The contagious period lasts 6 days, beginning with prodromal symptoms, and it persists until 2 days after the rash develop, at which time the antibodies first appear and that start killing the virus and clearing the virus from the body. Measles is most contagious transmissible virus known. It remains infective for up to 2 hours in the airspace or the nearby surfaces which come in contact with the person who is not infected, so that person can get the infection by the airspace or the nearby surfaces. Measles is contagious up to 90% of the non-immune people. I have already shown the slide in which the 9 out of the 10 people can be. Now, here one can have the aerosol that is less than 10 centimeter, but there is large spray droplets which can be of the size 1 millimeter, and that can drop up to the 6 meter if there is sneeze by the volume of 50 meter per second, and in case of the cough it can fall up to the 2 meter as it can be shown here, and just by the exhalation of the droplets one can have it reach up to the 1.5 meter. So that is the aerosol by cough, by sneeze, and the large spray droplets can fall up to the 6 meter distance. And if someone is inhaling in this area, which is the contaminated air with the droplets of virus, one can have the problem. Even exhaling can make reach the droplets up to the 1.5 millimeter. Here one can see by coughing, sneezing, one can just put the virus in the air and the other person can have it by breathing in that environment. Now, epidemiology. Prior to the vaccine era, measles occurred worldwide in an endemic or epidemic pattern in all races and all the climates, but in temperate climates, incident peaks in the late winter and early summer. Epidemics occur every 2 to 4 years and develop urban non-immunized population every 4 to 8 years in the rural areas. When number of the susceptible person reaches about 40% of the population, the epidemic lasts 3 to 4 months till number of the susceptible person fall below 20% of the population. Now, the certain risk factors, that is loss of passive inherited antibodies before routine immunization. Sorry. Unvaccinated missed booster shot, contact with someone who has measles, pregnancy, immunodeficiency caused by HIV or the AIDS, immunosuppression after an organ or a stem cell transplant, or using alkylating agents for cancer therapy, corticosteroid therapy regardless of the immunization status. So these are all the risk factors. So one can have unvaccinated child, unvaccinated due to the medical reason, then missed booster shot, and also the vitamin A deficiency is also said to be one of the risk factors. Then there is travel to a place where the measles is very much there, then contact with someone who's already having the measles, and then there is no vaccination, and the visitors from the area where the measles is already present there, so coming from that place can lead to the measles. Travel to the area where measles commonly occurs, contact with the travelers from these area, and population density, crowded institutions, and the standard of living is not proper, malnutrition, one reason for the excess mortality, and vitamin A deficiency, as I have already told you and shown in the previous. Be the flower between the grass, as one can see. It's very difficult to grow the grass which is having all the pointed leaves, and difficult environment where the flower is there. So one should also face the difficult situation and try to become and appear as a flower as it is being shown here. Now, the pathophysiology of the measles. Once measles virus gets into the respiratory mucosa, it infects the epithelial cells of the respiratory mucosa in trachea or bronchi. Measles virus uses a protein on its surface called hemagglutinin protein or H protein, as I have already shown you in the structure of the virus. This binds to a target receptor on the host cell, that is CD4/6, present on all the nucleated human cells. So the receptor are present on the host cell, and these protein, the H protein by which the virus is going to attach to the host cell and bound to the host cell. Once the virus is bound, the fusion or the F protein helps the virus to fuse with the membrane and get inside the host cell. So the name is the fusion. It just causes the fusion of the virus with the membrane and make easy the entry of the virus into the host cell body. As the virus is a single-stranded negative sense RNA virus, it transcribes its genome into a positive sense mRNA strand. Now inside the host, it translates the viral proteins to make the proteins like the viral proteins. And here one can see the trachea or the bronchi and heme agglutinin, as one can see the H protein and the F protein, and here are the receptors on the host cell. These are CD46, SLAM, and Nectin-4. These are the receptor on these epithelial or the host cell, and this virus by its H protein get attached to the receptors of the host cell. When it is get attached, the fusion protein now comes into action and it just causes the fusion of the virus inside the host cell by fusing with the cytoplasmic membrane of the host cell. So here one can see the virus causes the fusion and enter into the host cell, and here it is going to have attachment with the nucleus of the host cell, the DNA, the ribosomes of the host cell, and here the viral DNA, and that is just going to attach with the nucleus of the host cell. Here it is going to transcribe the proteins and just make sure that the new virus particles are being formed by this transcription and translation, and these are going to get out, budding out from the host cell as the new viral protein and the new virus, which is capable of infecting against the new host cells. So within days, the measles virus spread through the local tissue, and now it is being picked up by the dendritic cells and the alveolar macrophages of the respiratory tract. Now the virus is carried from the local lung tissue to the local lymph nodes. In the lymph nodes, here extensive replication occurs, virus spread and enter to the blood and then via the blood to the more lung tissue. This is called primary viremia. Now, finally, a second viremia occurs 5 to 7 days later, and now the virus disseminates to the mucosa of the respiratory tract, gastrointestinal tract, urinary tract, skin, conjunctiva, and the central nervous system to have the presentation there and making the symptom appear there. Now, here one can see the measles virus infection cycle, the measles virus that have gone to the respiratory tract. Here, that is being taken up by the alveolar macrophages and the dendritic cells, which are the defense cells of the respiratory tract. And here one can see these are just going to be taken up, and these just go to the local lymph nodes, and here in the local lymph node there is a replication occurs, and when there is intensive replication, and that is going to cause the dissemination through T and B cells, and here one can see the virus inside the T and B cells, and now they enter into the blood, and that is called the primary viremia. And from the blood, these viruses can go to the different body organs like spleen, from the spleen that get entered into the lymphatic tissue. From the lymphatic tissue, it can get entered into the skin and can get entered into the liver, and then it can go to the thymus tissue also and to the skin, producing the rash. So starting from here, entering into the respiratory mucosa, taken up by the alveolar macrophages and the dendritic cells, reach to the local lymph node where dissemination occurs and the replication occurs, and from there these are taken up by the T and B lymph cells which are entering into the blood causing the viremia, and then they are going to reach the different body organs like spleen, and from the spleen they are getting entered into the lymphatic system and to the skin producing the rash, to the liver, and then it can have the transmission through the lungs to the different other non-immune person. So here the virus replicates in the epithelial cells, endothelial cells, in the monocytes and the macrophages. Now appear the serum antibodies. The free virus is quickly cleared from the blood and the body fluids, but virus persists for various periods in the lymphoid, lung, bladder tissue, and in the polymorphonuclear leukocytes where the antibodies are not capable of clearing them. Now, Warthin, Finkeldy giant cells are pathognomic for the measles. These are formed by the infected cells with 100 nuclei and intracytoplasmic and intracellular inclusions. These are also seen in the mumps, rubella, and the yellow fever. These cells are formed in response to the infection by the measles viruses, and they are just trying to kill those viruses and the invading organism. So here one can see the Warthin Finkeldy giant cells. As you can see, the many nuclei, about 100 in number, and they are having certain intracytoplasmic inclusion and also the intranuclear inclusion also. So the summary of the pathogenesis and the pathology is measles virus enter to the respiratory tract and infect the epithelial cell. Here it multiply, and now these are being taken by the dendritic cells and the macrophages of the lung tissue, and then they reach to the lymphoid tissue and ultimately to the lymph node, and here they multiply very rapidly and replication is very fast. So these are being taken to the blood via the T and the B lymphocytes. So this is called first viremia, and now these multiply here and again enter into the bloodstream. That is called secondary viremia, and then they reach to the different body tissues and causing the general toxic symptoms of the measles. Now, the symptoms of the measles. Measles have upper respiratory tract symptoms during the prodromal stage, and it have got the maculopapular rash during the eruptive phase. As the name is, that is eruptive phase. Symptoms develop 10 to 12 days after exposure to an infected person, and that lasts for 7 to 10 days. The classical symptoms are 4-day fever, that is called 4 days, mean the fever that persists for 4 days. So that is called 4-day fever, 4 days, and the fever is always more than 40-degree temperature, that is about 104 degree Fahrenheit, and it is a combination of 3 C's and 1 P. It is 3 C's and 1 P. The 3 C's stand for cough, coryza with head cold, fever, sneezing, and the Third C is conjunctivitis, red eyes, and the P is for the photophobia. So the symptoms are just one can note down 4Ds, 4-day fever, and 3Cs, coryza, cough, conjunctivitis, and P for photophobia. Now, a red flat rash begins 3 to 5 days after start of the symptom, and here one can see the fever, the rash, the conjunctivitis, runny nose, cough, the sore throat, and the coplic spots which are formed inside the mouth. These are the pathognomonic. So only one serotype of the measles virus is there, and measles symptoms are high fever, red blotchy rash, first appearing on the forehead and behind the ears, then inflamed red eyes, that is conjunctivitis, the rash appear behind the ears, then spread over the head and the face, and then to the trunk and the extremities. There is a sore throat and hacking cough, stridor, and the coplic spots inside the mouth. These are very classical for this, and the runny nose. So, if you just collect 4Ds, 4-day temperature, and 3Cs, coryza, cough, and conjunctivitis. So, remember that 4Ds and 3Cs. Now the symptoms start on the rash start on the back of the ears, then spread to the forehead and the neck, then cover most of the body, as I have already shown you in the diagram and the slide. It includes the limb, palm, and the soles, causing itching. The rash has got changing color from red to the dark brown, then it disappears. It disappears in the same sequence 3 to 6 days later as it has appeared. So it goes back in the same sequence. Small white coplic spots may form inside the mouth 2 to 3 days after the start of the symptom. These are the grayish white spots, small as grains of the sand with the reddish areola. And here one can see the coplic spots in the measles, which are very classic. And again, here one can see the classical coplic spot. These are sand-like particles inside the mouth. Now, hemorrhagic spots occur opposite the lower molar. These spread to the whole buccal mucosa, and ananthem or any lesion inside the mouth, that is ananthem, or the red mottling present on hard or the soft palate. Then sometime there are seen the Stimson line is one of the symptoms of the measles, characterized by the transverse line of the inflammation along the eyelid margin, and there is one Stimson triad that is composed of cough, rhinitis, and conjunctivitis. So here one can see the Stimson's line lid, and these are also the characteristic of measles. Now, there are certain complications of the measles virus. These are diarrhea, which occurs in 8% population, midarian infection in 7%, causing the hearing loss, then pneumonia in 6% people, causing the viral pneumonia or the secondary bacterial pneumonia, seizure, thrombocytopenia, myocarditis, corneal ulceration leading to the corneal scarring and the blindness. Inflammation of the brain occurs, encephalitis, and laryngotracheobronchitis, group viral or the secondary bacterial bronchitis. Then rarely there is subacute sclerosing panencephalitis. So here one can see the measles, its complication are worst among the infants and causing the highest mortality, and it suppresses the virus suppresses the immune system and leading to the bacterial super infection, which is responsible for the otitis media and the bacterial pneumonia. Now, this measles virus can enter the lungs, causing the pneumonia. They can enter into the intestine, causing the diarrhea, and they can enter into the brain, causing the encephalitis, which are responsible for the death of the patient with measles. So, here are the complications of measles virus. 2 months after recovery, there is 11 to 13, 73% decrease in number of the antibodies against the measles virus. Death rate is 30% for children infected with measles from respiratory and neurological complication. High risk patients for the complications are infants and the children less than 5 years and adults aged over 20 years. They are also very prone. Then pregnant women, people with compromised immune system like leukemia, HIV infection, or innate immunodeficiency, then malnourished or those having the vitamin E deficiency, they are also very prone to have the problem.